My name's Edrisa Sanyang. I work at Western Kentucky University. I'm an assistant professor, but also the director of the graduate program in environmental fish technology. I started way back when I was in high school. I did geography, which was my major focus in high school. And I was introduced to a lot of environmental factors, and that becomes so interesting to me, especially with the intrinsic link between the mainstream environment, workplace, and people's health. So I decided to join School of Public Health, which I thought was the best institution at the time to definitely help address my, aspirations and my needs. Firefighters are one of the first responders that are doing a lot of great job in the country, but they do have some health concerns as well. So what we currently working with the firefighters is to understand how they operate, how they respond to emergency, and also their level of knowledge as far as infection control is concerned. This is so important for a couple of reasons. One, when firefighters do respond to emergency calls, they can either transmit infection to the emergency situation, or they can even be infected from the emergency situation. So those are critical components that we feel, they need to be built with skill and knowledge. In our own study, we are not just focusing on professional firefighters, but we also studying extensively the volunteer firefighters who has a lot of other responsibilities as their primary job. And in Green River Fire Association, which is located in Northwestern Kentucky, you have tons of volunteer firefighters doing some tremendous job. These are all big sacrifices, so understanding and studying them and helping them with solutions to better protect themselves, I think is very critical, in promoting or even helping more people to get into the profession and volunteer to help their communities. First and foremost, it will tell us specifically, where the gaps are in terms of knowledge. And, are those gaps very important for the transmission of biological contaminants? And if they are, what can we do to design some new programs to help firefighters improve those skills? And then eventually, how effective those skills would be in transforming their life and overall in transforming emergency response, across the country.